So we just covered 27 environmental risk factors for falling. The second half of the fall prevention checklist will focus on personal risk factors for falling. Personal risk factor number 1 is vision. Fall prevention and vision are closely related. If your eyesight is poor, your balance, your depth perception, your ability to find hazards and obstacles that are in your way will be decreased. So make sure to take the time, if your eyesight is suffering, take the time to see your eye doctor and get that corrected as soon as possible. Personal risk factor number 2 is hearing. Now, your hearing is also very closely related to your balance. If you're having trouble hearing on one side or the other side or both sides, it will drastically affect your balance and increase your chances of falling. So just like with the eye doctor, make sure to see your ear doctor as well. If they say you need hearing aids, make sure you wear them. It makes a big difference. Personal risk factor for falling number 3 is muscle weakness. The average human loses 1% of their total muscle mass every year after the age of 25. So if you're not doing anything to exercise, if you're not doing anything to maintain your muscle strength, it will continue to go down and your fall risk will continue to go up the more muscle you lose. Personal risk factor number 4 is medication. If you're taking any kind of medications that are making you dizzy or sleepy, your chances of falling down will increase. So make sure you talk to your doctor if you're having any of those side effects and see if they can put you on some kind of an alternative that'll make it safer for you. Personal risk factor number 5 is postural dizziness or postural hypotension. When we sit up or stand up quickly, there's a change in blood pressure that happens that often causes dizziness. Now, if that's happening to you, the most important thing for fall prevention that you can do is basically be aware of it. So know that if sometimes you stand up, you get a little bit dizzy, try to stand up a little bit slower, try to sit up from a lying position a little bit slower, and then make sure you stand next to something you can hold on to in case you get dizzy. Personal risk factor for falling number 6 is balance. Now, there are a lot of different factors that go into balance problems, some of which we've already talked about, like vision and hearing and certain medications. The easiest thing that you can do to improve your balance is a consistent exercise routine that focuses on muscle strength, coordination, and agility. Personal risk factor for falling number 7 is gait or walking pattern. If people develop a walking pattern where their feet are shuffling along the floor instead of lifting, their chances of tripping over a step or tripping over some other kind of obstacle are increased by quite a bit. So there's 2 things you can do. If your feet are shuffling, the first thing you want to do is be aware of it and try to make a conscious effort to lift your feet up higher when you walk and when you step over things. But number 2 is you can also do exercises that will improve your ability to lift your feet. I've included exercises in the bonus sections that'll help you do just that. Personal risk factor for falling number 8 is neuropathy of the feet. As people develop neuropathy of the feet, they start to get a lack of sensation and a numbness throughout the foot and the lower leg, which greatly affects balance and stability. So if you're starting to notice signs of neuropathy or numbness throughout the feet, make sure to talk to your doctor about it right away. Personal risk factor for falling number 9 is advanced age. As we get older, our chances of falling and being seriously injured in a fall increase. Remember that more than half of the people over 80 years old fall every single year. So although there's nothing you can do to change your age, for fall prevention, the most important thing to do is maintain a safe environment and maintain a good, solid exercise routine. Personal risk factor for falling number 10 is disability and disease. If someone has had a stroke, which can cause massive instability, or if they have Parkinson's disease, which can cause balance problems and a shuffling of the feet, or if they have diabetes, which can cause neuropathy of the feet, any of those factors will increase the chances of falling. So depending on what condition you have, you want to maintain your medications, you want to maintain your exercise routine, you want to maintain a safe environment, and then if it applies to you, you also want to make sure you get yourself a good assisted walking device like a cane or a walker and make sure you use it properly. Personal risk factor number 11 is osteoporosis. Osteoporosis is a condition where the bones become porous and brittle and much more prone to fracture. So if you have osteoporosis, your chances of a major injury when you fall are highly increased. So what you want to do is make sure you get a simple bone scan from the doctor and also have them check your calcium and your vitamin D levels. Exercise can also be a major factor in preventing and treating osteoporosis. Now there are 3 more major personal risk factors for falling that we haven't covered yet. Number 1 is improper use of assisted walking devices like canes and walkers. Number 2 is improper shoes and footwear, which lead to falls. And number 3 is a lack of exercise. So the next 3 parts of this section will be dedicated to those 3 things. So coming up next, how to properly adjust and use canes and walkers for fall prevention. I'll see you in just a second.